Ever pondered why trauma and addiction appear intertwined, often dancing a destructive tango in the lives of many adults? It's a question that has sparked curiosity and concern in equal measure. There's an undeniable pattern that we see in the world around us. Trauma and addiction seem to be partners in crime, persistently showing up hand in hand. It's as if they're two sides of the same coin, spinning in an endless, heart-wrenching cycle. The world of scientific research has not turned a blind eye to this curious connection. Scientists have delved deep, tirelessly probing the shadows to illuminate the truth that lies beneath. What they've found is as fascinating as it is impactful, shedding light on a connection that is far more complex than it may initially appear. So if this connection is not mere coincidence, what could possibly be tying trauma and addiction together? Scene script. Science has delved into this intriguing connection, and the findings are quite revealing. To get a grasp of this, we must first understand that our brain is a complex organ, wired with a network of neurons that communicate through chemicals known as neurotransmitters. When an individual experiences trauma, it can disrupt this delicate balance, leading to changes in brain chemistry. Scientific research has shown how these changes can make an individual more susceptible to addiction. For instance, a study published in the Journal of Neuropsychopharmacology found that trauma can increase the production of a neurotransmitter called dopamine. This is significant because dopamine plays a crucial role in the brain's reward system, which is heavily implicated in addiction. When we engage in activities that are pleasurable, our brain releases dopamine, creating a sense of reward and satisfaction. However, when an individual experiences trauma, the overproduction of dopamine can make them more susceptible to addiction. This is because substances such as alcohol, nicotine, and drugs can also trigger the release of dopamine, creating a false sense of reward and relief from the emotional pain caused by the trauma. Furthermore, research from the National Institute on Drug Abuse has shown that trauma can also affect the brain's stress response system. When faced with a traumatic event, our brain releases stress hormones to help us cope. However, chronic exposure to trauma can disrupt this system, leading to an overactive stress response. This can make an individual more likely to turn to substances as a way of self-medicating, as these can temporarily dampen the stress response and provide a sense of relief. In addition to these biochemical changes, studies have also shown how trauma can affect our brain structure. For instance, research published in the American Journal of Psychiatry found that trauma can lead to changes in the size and function of the amygdala, a part of the brain that's involved in processing emotions and fear responses. These changes can increase an individual's vulnerability to addiction, as they may find it more difficult to regulate their emotions and cope with stress. Therefore, the link between trauma and addiction is not just a social observation, but a reality backed by science. Now that we've unraveled this scientific connection, what are the key points to remember? Firstly, it's crucial to acknowledge the profound impact that trauma can have on an individual's life, especially when it occurs in adulthood. This is not a simple case of mind over matter, but a significant shift in an individual's brain chemistry. It's like an unexpected storm that changes the landscape of one's mind. This altered state often leads to a heightened vulnerability to substance use. The substances may give a temporary relief from the pain, but they're also setting up a dangerous cycle of dependency. It's not a choice, but a desperate attempt to cope with the distress that trauma has inflicted. Secondly, understanding this link between trauma in adulthood and addiction, we realize it's not just about treating the addiction itself. It's about addressing the root cause, the trauma, and providing the necessary support to navigate through its aftermath. It's a holistic approach that involves healing the mind, body, and spirit. Lastly, this understanding equips us with a powerful tool to combat the stigma associated with addiction. It's not a character flaw or a sign of weakness, it's a complex interplay of biological, psychological, and social factors. By acknowledging this, we can create more compassionate, effective strategies for prevention, intervention, and recovery. Understanding that trauma and addiction are often linked gives us powerful insight, not only into the causes of addiction, but also potential paths to recovery. Indeed, the interplay between trauma and addiction is a complex one, but understanding it can be a game changer. It's vital to remember this knowledge can illuminate the path towards recovery, offering a beacon of hope. In our upcoming content, we'll delve deeper into such intriguing topics. We're all on this journey together, learning, understanding, evolving. Thank you for joining this enlightening journey. Click like if you found this informative and don't forget to subscribe for more insightful videos.